They look very much the same. And there's not a huge disconnect between the two treatments. So that's encouraging that no significant new unexpected side effect was identified that we have to worry about. That said, of course, there's one that gets everybody's attention, and that's photopsia.
Exactly.
And, photopsia is this phenomena that occurs infrequently. It's unpredictable, described oftentimes as sort of seeing a little bit of a flashing light, as you might see coming out of a tunnel. And it's very transient, doesn't have any anatomical abnormality associated with it after it's been interrogated very carefully by ophthalmology. Doesn't impair day-to-day function. And as I said, it's transient. So after carefully interviewing patients who've experienced that phenomena, they didn't feel that it was such that it would deter them from being on the medication. So I think it's something that's, again, with every new drug, there's potentially something unique. Maybe this is unique, but it's not something that has resulted in any less encouragement or enthusiasm about using the drug.
So talking about the side effect profile with this drug, one of the things that's also been talked about is the bradycardia. What's your experience with that?
So a lot of the SERDs, the newer drugs that are being developed, seem to have a fraction of patients who develop bradycardia. And quite frankly, if we were in clinic, we probably would treat it. We wouldn't, if they weren't on a clinical trial, I should say, it wouldn't even come to our attention. We wouldn't pay any attention because it tends to be asymptomatic. It's not impairing them in any way. But under the guise of a trial, you have to actually track these things. And if your pulse rate is a little bit low, it's picked up and it's recorded. But it isn't clinically relevant.
Now, one of the big criticisms in the clinical trial, which is unfortunately true for many clinical trials in our area of where we study, is the racial diversity and the question then how applicable the data might be, especially if we look at molecular subsets and whatnot. What would be your counter argument to that?
The trial composition with respect to patient demographics was pretty similar between both treatment arms. And the challenge we always have, at least in the US, is having a representative population. And again, we fall a little bit short in terms of having the fraction of African Americans we'd like to have in trials. It was only a few percentage points in each group. Again, very well balanced across it, but it really is a challenge that we have to rise to meet, I hope, in subsequent trials, getting even more populations that don't typically participate in trials to do so. But again, there's no reason to think the trial results are impacted by that. They're very well balanced.